Hi, I'm Sophia, a tech assistant here at Lock Haven Veterinary Hospital, and today I have Dr. McIntosh who's going to answer some questions about puppy vaccines. Dr. McIntosh, what vaccinations does my puppy need?
So over the course of your puppy's puppyhood, there are a lot of vaccinations that they do end up needing. We do repeat some of those vaccines regularly to make sure that they mount their own immune response to it. But the most common vaccines you'll see a puppy get are going to be their distemper, hepatitis, parainfluenza, and parvo. Those are going to be all together in one vaccine. They would potentially get bordetella, which is a respiratory vaccination. Canine influenza virus, depending on their locale. We see it a lot here in this area and with boarding animals. Leptospirosis is another thing that's really prevalent here in Florida, so we do vaccinate puppies for that as well. And then when they're old enough, they get their rabies vaccine.
What are core vaccines?
So core vaccines are vaccines all puppies should get, regardless of their location, regardless of their environment, and regardless of what their lifestyle is. Core vaccines are usually the rabies, the distemper, which is the combination vaccine, and veterinarians sometimes will add bordetella or some of the respiratory vaccines in there. Core vaccines can be dependent on where you're living. Some of them might be core for one area but not for another because we see more of that disease somewhere.
What are non-core vaccines and why does my puppy need them?
So non-core vaccines depend on your puppy's lifestyle. So things like Lyme vaccine, which is a disease we typically see more farther north, but we are seeing it come down here every so often. Not all puppies, not all dogs need that vaccine, so we don't vaccinate all puppies for that. If your puppy is never, ever, ever going to be around other dogs or in places where other dogs are going to be, some of the respiratory vaccines we don't really get too worried about, but it really depends on what's going to happen, and I'd rather have an over-vaccinated dog than an under-vaccinated dog that's not protected.
How often does my puppy need to go to the veterinarian for puppy vaccinations?
So vaccines, when they're puppies, we typically give every 3 to 4 weeks until they're done with their whole series. And like we said, a couple of those vaccines, they get them and then they get them boosted again. Some of those vaccines, they get boosted 2 or 3 times, depending on how old they are when they get their last booster. But we want to make sure that those vaccines are creating immunity in the puppy, and that's why we give them on a more regular basis, but that's why we give them more than once. And it really depends on what time and how old your pet is when we give that last vaccine.
Are there any risks associated with vaccinations?
So risks of vaccinations are pretty minimal compared to the risks of not having them. Some of the diseases that we vaccinate for are pretty severe and can be lethal, especially for a young puppy who's just developing and growing. So making sure that we get those vaccinations on board are super important. Every so often we'll see something called a vaccine reaction, where a puppy may get a swollen face or may be really itchy or may have an allergic reaction to the actual vaccine or things that are in the vaccine. Those guys we have to identify, and then we treat them, usually give them some medication before they get their next set of vaccines, and they do okay. For some of those guys we see vaccine reactions, will actually separate their vaccines and only give one vaccine at a time to make sure we know which vaccine is causing a problem. 9 times out of 10 we're still given vaccines in these guys. We just want to make sure that we're protecting them as much as possible and being as safe as possible.
Does my puppy need vaccinations even if I keep them inside?
Absolutely. So puppies, even if you keep them inside, they literally never see the light of day and never touch the ground. There are things that you can touch another dog outside. You can bring it on your shoes because there's other dogs in the house, or other dogs in the neighborhood. It's definitely something that just because your puppy's isolated doesn't mean he doesn't need vaccinations. And again, some of those diseases that we vaccinate for are particularly severe or particularly lethal, and we certainly would rather vaccinate them, have them be safe just in case, even if the one thing is they might get out one day. We want to make sure that they're safe if that ever happens.
What if I miss one of my puppy's vaccinations?
So timing is really important on puppy vaccines, especially those ones that get boosted on a regular basis. We want to give them within a 3 or 4 week time span. If we give vaccines closer than 2 weeks apart, we actually invalidate some vaccines. So we don't want to give them more than 2 weeks apart, but we also don't want to give them more than 4 weeks apart if we're vaccinating for the same thing, because that series, we'll have to actually restart that series so that we know that that puppy is boosted and protected from that disease.
Thank you, Dr. McIntosh.
Thanks. If you have any questions about your puppy's vaccines, you can give us a call here at Lock Haven and we can get you in to see one of our veterinarians.